Hey everyone, I'm Sarah with Medoma, and today we're going to be talking about a super frequent symptom that people have when they come in, and that is foot pain. And a lot of times we're asked, can you help my foot pain? Do you do massage for feet? We absolutely do massage for feet. A lot of people have some chronic foot pain that we treat, and we would love to help you out with that. So you can visit medomamassage.com to sign up for your introductory massage offer. So today we're just gonna talk about some different types of foot ailments that you may be experiencing, and you may just be like, I don't really know what's going on, but hopefully you find some answers. So if your toes are always cold, one reason could be poor blood flow. A circulatory problem is sometimes linked to smoking, high blood pressure, heart disease, even nerve damage involving uncontrolled diabetes can also make your feet cold. Hypothyroidism and anemia are also things that can make your feet cold. I struggle with anemia myself, and my hands, my fingers and my toes are cold a lot of times. So that's definitely, an underlying problem. When your feet ache after a long day, a lot of times you just want to take off your shoes and throw them aside, and even be mad at your shoes just for how they've made your feet feel. But 8 out of 10 women actually say their shoes hurt. Pain that's not due to huge heels may come from a stress fracture or a small bone spur. A lot of times when you're playing a high impact sport like basketball and distance running, a lot of times you can get bone spurs and fractures without even knowing it. Also, weakened bones due to osteoporosis increase the risk of these things in your feet. Raynaud's syndrome can actually cause your toes to turn white. Then they might actually turn bluish, and then they might turn red. So a lot of times Raynaud's syndrome is called red, white, and blue syndrome. Anyway, it's eventually they'll return to their natural color. But if you are experiencing just some different colors in your feet, it very well could be Raynaud's syndrome. The cause is a sudden narrowing of the arteries called vasospasms. Different stresses in your life or changes in temperature can trigger these spasms. I'm so sorry, people, I can't talk today. Raynaud's may also be related to rheumatoid arthritis. My sweet friend of the family has rheumatoid arthritis, and she suffers from Raynaud's, and it is not a fun thing to deal with. Thyroid problems can also contribute to this. Heel pain. A lot of people have heel pain. The most common cause is plantar fasciitis, which is inflammation where the long ligament attaches to the heel bone. The pain might be sharpest when you first wake up in the morning and when you put pressure on the foot. Arthritis, a bunch of exercise, and even poorly fitting shoes can cause a lot of heel pain and can also cause tendonitis. So less common symptoms of heel pain are bone spurs on the bottom of the heel, a bone infection, tumor, or fracture. Sometimes you might start to notice a difference in the way that you're walking. That can be the first sign of a problem. A wider gait or even a slight foot dragging. These are all causes for concern. The cause might be the slow loss of normal sensation in your feet brought on by peripheral nerve damage. About 30% of people that deal with these cases are linked to diabetes. Nerve damage can also be due to infection, vitamin deficiency, and even alcoholism. In many cases, no one knows what's actually caused the nerve damage. It could be even things that are happening in your brain or spinal cord or muscles as well. Clubbing. I don't know if anyone has experienced clubbing. When I think clubbing, I don't know. I just think of all the toes being together. That's not actually what it is. Clubbing is when there's actually a claw effect in the shape of the toes. And sometimes even your fingers change as well. The nails are more rounded on top and even curved downward. Lung disease is the most common underlying cause, but it can also be caused by heart disease, liver and digestive disorders, or even certain infections. Sometimes it even clubbing just runs in your families without any underlying disease. Let's see, swelling of the feet. If you are dealing with swelling of the feet, a pregnancy, of course, is a symptom of this, but if you're not pregnant, feet can be a sign of a serious medical condition. It might be poor circulation. It could be a problem with the lymphatic system, a blood clot, even a kidney disorder, or underactive thyroid can also cause swelling. You definitely, if you have persistent swelling, you definitely want to see your physician. Just a couple more here. A burning sensation in the feet is really common among diabetics with peripheral nerve damage, and neuropathy. Can also be caused by vitamin B deficiency, athlete's foot, chronic kidney disease, poor circulation, and hypothyroidism. So definitely those, I'm so sorry. Foot sores that are not on the heel are actually a warning sign for diabetes. If you're having foot sores, so other places besides your heels, then you definitely want to get checked for diabetes. Diabetes can impair sensation in the feet, circulation, and a normal wound healing, even a blister can become a troublesome wound. So you definitely want to take care of that. Slow healing of sores can also be caused by poor circulation in your feet from conditions such as peripheral artery disease. The last couple I'm going to go over, this next one is gout. It's notorious for causing sudden pain in the big toe joint, along with redness and swelling. Osteoarthritis is another culprit that can cause pain and swelling. If the joint is rigid, it might be something else, a complication of arthritis where a bone spur develops. Turf toe is an ailment of athletes a lot of times, particularly those who play on hard surfaces. It's caused by an injury to ligaments around the joint. If you have ever felt like you're walking on a marble, or if pain burns in the ball of your foot and radiates up into the toes, you may have something called Morton's neuroma. It's a thickening of the tissue around the nerve, usually between the third and fourth toes. It's 8 to 10 times more common in women than in men. It can also be caused by injury and too much pressure on the toes. So those are just a few of the different things that we deal with within our feet. We would love to help you out if you're having any type of pain in your body at all, particularly foot pain. We would love to help you. You can visit medomamassage.com and we can get you fixed up. Thank you so much for joining me today. I hope you guys enjoy this beautiful weather.